I see one last question in the back there.
Okay, let me put my point from a pediatrician in practice here in Miami. I think that I have heard you, very important panel. I think that the information you're giving is very valuable. I've been in private practice for over 20 years, and the concern that I have, which is what I feel is important to keep the Q, which is the quality of medical care here in Miami, is to keep the people who have good quality of medicine incentives to keep them maintained in the city. So I think the challenge for us is what I see is physicians leaving Miami because they can't find what they are looking into. What incentives we have in Miami to keep this very good physicians without leaving Miami? That's the whole issue that I've seen here in the practice. Thank
you. Okay, we'll take it.
Michael, I've heard Mark talk just a tiny bit about government, how it's seen from Tallahassee down here. Frank said something about dragging them along. The panel hasn't addressed, other than Bill, with his federal government stuff, whether local government is a liability or a Q.
That's a good question. That's a good question. Anybody who doesn't, anybody want to talk about it? Here, Bill.
I'll actually bridge to what I just whispered to Michael. I mean, one of the things that's very important in this global, world-class luxury community is we've got a convention center that was last modernized and expanded when George Bush was president. The first George Bush. We really need desperately to have that building come up to the standards of our community. And there's been a lot of talk about that, and there's more talk now about how to fund lots of things. But in order to be competitive on the meeting side, one big hat we wear is the leisure side, the vacation side, but another contract we have is to sell the meeting facilities, both in hotels and the exclusive sales agent 2 years out of the Miami Beach Convention Center. That building needs to be modernized and expanded just like every city. And by the way, we're way behind second and third tier cities. And if you go around the world, whether it's San Juan, Puerto Rico, we're out of step. We've got this global, beautiful, wonderful, world-class community, and we have a box that needs to be modernized and expanded. Did that bridge okay there? And that's a government responsibility. That's owned by a government, managed by a government, and is financed by government. So thank you for that.
Well, I'm not going to make a general observation about the quality of government, but I can say the following, that from the university perspective, as we've expanded the conversation about partnerships and engagement, we found incredible receptivity at FIU from municipal and county government. I'll give you 3 quick examples. The city of Palmetto Bay is building a new city hall, and they requested to meet with our environmental specialists and facilities so they could understand how to work in a collaborative fashion with our people on making sure that they get an energy efficient building. And we just had that meeting. Second of all, Metro-Dade government knows that we're interested in placing our students, and they approached us to open up internships for students with disabilities, and we've started that. We have 10 students working in Metro-Dade County government offices at their instigation. And then thirdly, the city of Sweetwater has embraced very warmly students from our honors college to work with them to help them address a whole set of planning and public policy projects. So I've been very pleased with the openness of government to collaborating with Florida International University, and so I couldn't be happier.
Let me take a whack at some of this, at Mike Pearl probably. I think that one of our frustrations, and I'll be very candid, is on the state level. Quite frankly, we have not seen, in the way that we think it should be, economic development have a priority in this state. And I don't think there's a common vision, and I don't think there's a common goal as to where we need to be, or even an understanding. And it's very frustrating when you are competing against some of the other states who seem to get it, like Georgia and the Carolinas and internationally, the places we compete against. So it's been difficult, and I would say that's encouraged more recently than before. I mean, I think, and again, I don't necessarily like one group over another. I like all my children, so to speak. But the reality of it is that when Jeb was governor, for example, we had a very active, a very knowledgeable, and a very engaged leadership, not just at the governor's level, but all the way through the system. And quite frankly, we don't see that as much as I think we. On the other side, and I think Mark's comment, they can't see Miami from Tallahassee is part of that problem. But I do think that on the local level, I have to say that over the years, we've seen increasingly better and better cooperation. We meet regularly now with a lot of the local mayors who are really supportive and really helpful and quite frankly do get it. I just had a recent meeting with the new mayor of Miami, Mayor Regalado. Couldn't have been more gracious, couldn't have been more willing to work with us. Was really, I think, excited about the prospect of developing a very good partnership. And on the county level, look, we all read this stuff, and we know there are issues there. But there's a lot of good things that county does do. And I think that we see it because we deal with them every day. I mean, permitting years ago used to be a nightmare. No more. We really can get our permitting done relatively easy. There's always going to be issues, but compared to what it was, it's changed 180 degrees. And we were one of the biggest critics on permitting. The airport, I mean, Billy talked about Abreu. He's been terrific. I mean, he just has done a great job. Billy Johnson, as our seaport director. A lot of challenges given what's happening with the global economy, but he has positioned this seaport to be in great shape as we move forward. So I think that government, in some ways, it's a mixed bag, but there are a lot of good things that our government here does. I mean, George Burgess, you may not agree with 100% of everything that he does. Hell, I don't agree with 100% of what he does. But the reality of it is he is a professional, and he does a good job, and he's an honest guy who I think is trying to do the best he can. With very trying time, Billy talked about reduced resources. Boy, it's tough when you get to see those budgets keeping collapsing and trying to maintain the level of service that you have to have. So it's a mixed bag out there. Some are better than others. Some governments are better than others. Some are more responsive than others. But where I'm most disappointed in, quite frankly, is on the state level, both from the legislative side, and again, good legislators, but caught up in a whole lot of other issues that they have to deal with. But I have not seen the kind of leadership and vision that we would like to see on the economic development front. Being as honest as I can.
Well, just let me say that one of the promising developments at the state level is that the Florida Chamber and the Florida Council 100 and Governor Christ and the legislative leadership, I think, do get it. The challenge that we have is that as term limits really undermines the ability of our legislators to take anything other than a short-term view. And so, for instance, Governor Christ just made a major announcement today on higher education at public universities. I have seen few other governors who have been willing to do that. So he's willing to go out on a limb. And, but some of that is lost in the noise of, the contentiousness that we all feel now, at the state level.
Steve, we have one last question. You get it.
Thank you. I'd like to raise the subject of medical tourism. And as we all know, it's become a very challenging and aggressive industry. So who do you see as being our #1 domestic competitor and offshore competitor? And within each of those, why?
Well, medical tourism is a hot topic right now. PricewaterhouseCoopers did a study, I'm sorry, I think it was Deloitte & Touche, or maybe it was Pricewaterhouse, probably the most comprehensive study, and they articulated there's 825,000 medical tourists Boston Consulting said it was 250. There's a huge difference there. Nobody knows what the numbers are. And the big concern they have is that Thailand and Singapore and India are going to attract U.S. tourists over there. We haven't seen any loss of tourists to those type of countries that have these sophisticated hospitals. What we see is people leaving for Latin America for dental procedures and plastic surgery. Many times they come back to get those things fixed and everything. So I don't perceive that as a major threat to us right now at this point in time. But we do take it very seriously, and of course we're looking at medical tourism, bringing those people here to the United States. So our focus is really on quality and service, and if we can beat them in quality and service, and these are the people that are affluent people who have insurance or they have significant resources, we're finding out that they really like coming to the United States for their health care.
So what do you see as our primary domestic competitor?
The domestic competitor, probably the Cleveland clinics and the Mayo clinics and Johns Hopkins and people like that are pretty aggressive down there. But I think our success is we've been unilaterally focused on Latin America and the Caribbean, and we've really been extremely successful at their losses are gained very definitely. So, and I think and the reason for that is that they have great organizations and everything. They're looking at the world. The world is too big for me. We're looking at Latin America and the Caribbean. We're very focused. We have a laser focus, and consequently, we've been extremely successful.
Just briefly, I think, as you know, the Bureau recently, in partnership with the Greater Miami Chamber, a number of the hospitals have launched a new medical tourism program that follows the Miami brand that we have, and we're excited about that, and it is largely focusing in on Latin America.
We've got a great panel here today that I think has shown us some perspective on what's good, what could be improved, and even offered some directions as to where we might be heading. I think the One Community, One Goal revival is a step that could be taken. It's practical, and so we've got actually an answer for some of these things, or a potential answer coming up. I want to thank our audience, but I want to thank our great panel. Let's go to the panel.